Welcome to the BrendanGPodcast. I am Brendan, and I am joined today by Dr. Jason DuBois. He is my co-host. And today we're going to be talking about RFK Jr., who was a sort of a surprise recently, at least politically, in his conversations with the Trump administration. Should Trump get elected, there is discussion as to perhaps RFK Jr. playing a significant role in America's health. And we're going to be discussing what that might mean. Some of his ideas are rather unique. More specifically, we're going to be discussing chronic disease, our food supply system, and we're going to touch on some of the pesticides that are commonly used within farming. So I think that's a really important component of this. So with all that being said, I'm going to turn this over to Jason. Go right ahead. Lead us in here on chronic disease. Tell us what we're missing.
Well, chronic disease is a huge issue in America, but I want to pause and just talk about RFK Jr. And
yeah.
I didn't really know much about him, to be candid. I get kind of tied up in what I'm doing with my business and my life, and I don't follow politics as closely as probably a lot of people do. But when Trump made that recent announcement about appointing RFK Jr. to his cabinet and kind of taking over the healthcare, which is in such dire need of reform here in the U.S., I did a deeper dive on this guy, and of course, in lead up to this podcast. And I don't know how you feel about it or what your position is on him, but some of the things he is saying and promoting really resonates with what I believe in. And we're just going to talk a little bit about that today, some of the things. But I don't know, Brendan, if you felt the same way when you were doing your research on him, but some of the things that he believes in, I also, it echoes with me.
Yeah. And it's one of these things where I try to stay away from politics as much as possible, try to stay somewhat neutral. However, I grew up in a household that, it was an Irish Catholic household. So they definitely revered JFK, right? So RFK was somebody who I followed, but like yourself, not that closely. I didn't really understand his politics per se. I knew he was very active in the environmental arena. But you're right. When we started to do some studying on this, it was crazy to me how closely aligned his ideas and philosophies are with my own, and his dedication to rooting out regulatory capture. That's really important, especially when it comes to our food and overall health in this country. So yeah, I was surprised.
Yeah. So one of his big platforms, and I don't know who came up with this slogan, is "Make America Healthy Again," right? So we have Trump's slogan of "Make America Great Again,"
right?
And then RFK Jr. came in and kind of dubbed "Make America Healthy Again," and it's kind of corny, I guess, but there is an essence of truth to that, because America is unhealthy on so many different levels, and chronic diseases. You talk about America being great in any particular area or ranking number one. We rank number one in healthcare or lack of healthcare. We rank number one in chronic diseases, and
in healthcare spend too, right? So there's a real paradox here.
And we spend the most amount of money, yet we have the highest percentage of chronic diseases in the world. And today, hopefully in our podcast, we'll be talking about, or at least trying to uncover, why is that, right? So what is leading to this huge issues of chronic disease throughout America? What are the underlying issues? I'll talk about what I think are the underlying issues. But most importantly, toward the end of the podcast, I'm going to press on you, Brendan, on three things that, if we were to be given this magic wand and change something, what are the three things that you would change in America if you had that power? But let's talk about chronic diseases, right? So it is an epidemic. It's a serious epidemic in America. I was just reading some stats. It says that chronic diseases are linked to 7 out of 10 deaths in America, which is just outrageous. And it results in killing or the deaths of 1.7 million Americans. Those statistics are just mind-numbingly huge. But the top, if we were just to kind of focus on the top three, Brendan, if you had to guess the number one, what would you say would be the number one chronic disease that most Americans suffer from?
I would say cardiac disease, probably.
That's definitely, yes. Heart disease
Chronic,
is number one.
yeah, chronic inflammation.
And chronic inflammation. And then the other one that's a kind of a huge tie-in is obesity.
Obesity, of course. Yeah, right.
And,
Recently dubbed diabesity, right? The combination of diabetes and obesity is overlapping there. Yeah. Yep.
yeah, 20%
Makes
of
sense.
children in America are obese,
That's
and
crazy.
42% of adults fall into the obesity category. Um, and obesity leads to other issues, as you've already said. So obesity is heavily linked to diabetes, type 2, and it's also heavily linked to cardiovascular deaths and events in America.
Yeah.
So one of the things I like about RFK Jr. is he's really addressing that and attacking that head on. And in some of the podcasts I was listening to, he had some really great ideas about how do we get America healthy again, and
Yeah.
addressing at its core the overweight issue, right? So I was just fascinated by that, and some of the things that he's thinking about doing. It ties into other issues like corporate capture and stuff like that, which we'll
Yeah.
get into in a moment. And it also ties in intimately with the quality of foods that we have here that are available to us. And I think that's quite obvious, but I'm pressed to try to figure out why we still are subjected to some of the chemicals and foods that we have here in the U.S. that are not found overseas. And I don't know if you've traveled overseas, Brendan, but there's a
Hmm.
big difference.
Yeah, I absolutely have. And especially if you travel over to Europe or even countries in South America, which we sometimes think of as like, they're third world, they're so behind us. And yet they've gone ahead and banned a lot of the things that we say is perfectly fine here, which are causing a lot of the problems that we're talking about, chronic inflammation and chronic diseases. But I know
Absolutely. Yeah.
you've traveled to Europe. What are your thoughts on that? What have you seen?
Well, I haven't done as much travel as I'd like to, but my fiance and we recently took a trip to Portugal and had an amazing time. We traveled the whole countryside of Portugal, visiting many cities. And there was two or three observations that just kept coming up. Like I wasn't even
Yeah.
looking for this, but it's just so obvious that
Yeah.
you can't ignore it at some point. The first one is that the Portuguese people are very big on fresh fruits and
Mm.
vegetables and meats and fish. So
Right.
the staple of all of their food is healthy meat, grown countryside, fish, which is, they have an abundance of coastline there to be able to
Right.
get fresh fish. Um, and it's just every meal, everywhere we went, it was just healthy. I didn't see a whole lot of fast food
Right.
in Portugal. And again, I went to many different cities. The other thing I noticed about the Portuguese people, at least in my observation, is I saw very few overweight people.
Right.
And I don't know if that is representative of the food they're eating,
Hmm.
or should I say the food they're not eating,
Yeah.
or
Right.
is it a reflection of just Portugal as a whole, and that in that particular country, there's you walk a lot, you bicycle, um,
That's fair.
the countryside is somewhat hilly in a lot of places. So I found myself being pushed to my physical limits when I was, walking the streets of Portugal. But I just found those two things, just very simple observations. I was there for about 11 days, and I just kept noticing it over and over again.
Yeah, and it's interesting. They certainly eat a lot of bread. Portuguese are known for
Oh yes,
making really
yeah,
good bread.
it's really
So,
good.
like, isn't that one of the things that we're constantly being told here by doctors? Okay, cut back on your alcohol consumption and anything white, avoid, right? So, sugar, bread, all that stuff. Okay, well, they're doing that over there, and yet they're still maintaining their health. So, while I think it is a contributing factor, clearly it's not like a main driver, right? So that's one of the things that I picked up.
For sure. And I had the same experience. The other time I visited another country was I went to England many years ago. And similar expectations, similar results, so in England, one of the things I didn't notice, and I also didn't notice this in Portugal as well, is an absence of the artificial sweeteners.
Yeah.
And I'm guilty. Like, I used to use a lot of those in my coffee. I like drinking coffee, and I would use, for a long time, I was using Splenda. And I went over to England, and when I was there for just a handful of days, I could not find that anywhere. But again, I think it extends far beyond just Splenda. Like, the other observation I'll tell you that I saw in England is that they don't allow soda refills. And we go to a restaurant here in America, and it's like you can get endless refills of soda.
Yes.
And that's not so true in England. And they also cap the size. So they only allow you a certain size of soda that they'll sell in convenience stores and in restaurants. So I found that was interesting.
Well, I can tell you, I'm sure the politicians in Philadelphia would be on board with that, because I think at one point they tried to ban sodas within Philadelphia, if I'm not mistaken. But but again,
New York, they tried to cap the sizes in New York.
Oh, that's right. Yeah. But but is this a policy, you think, in England, or is this just the way people want it? And
I don't think it's a policy. I'd have to look that up, but to me, it's like a cultural norm.
So thank you guys for listening. We'll see you in the next episode.